Here's someone else coming in. Okay. Oh,
Lucy's going to come in here and watch it with me, Devin.
okay.
Oh, okay. All right, hold on.
Is it officially live? I think so. Okay, I think I can exit out now.
Lucy's going
Okay, yeah. All right, guys, we'll get started here shortly. Looks like Tony is still coming on.
Okay.
And then Nancy, go ahead, put your contact information in the chat section too. That way, if you want to get a hold of anyone after this, or someone wants to get a hold of you too, we can do a little bit of networking while we're at it.
Okay.
And then I'll put my contact information in. All right, there we go. I'm just playing around with the YouTube here. I'm going to see if I can share it on Facebook. Hi, Blair.
Hello, Devin.
Hi, how you
Murray,
doing?
Nancy, Laura, Kendra, Tony.
Hi there, how are you?
Good.
Good.
Devin, FYI, probably about 12:30, I'm going to have to flip to my phone and drive. So you'll see me come back
You
in
are
again.
all good, Miss Blair.
Hey, Laura, is that a backdrop behind you or are you actually in a building?
It is a backdrop.
Oh, it looks really
You
like
can't
you're
tell.
actually,
It looks
yeah.
like seamless.
I know. You know, it's in the front lobby of MD Anderson West Houston. And so it just kind of makes me feel like I'm there, even though I'm not.
After a year, right?
Yeah. You're in a month. Who's counting though, right?
Right?
Me.
Hi, Sarah. Oh,
Hi. Good to see everybody.
good to see you too, Miss Sarah.
Thank you.
Hey,
Hello,
Sarah.
Sarah.
Hey.
Sarah.
I am so looking forward to this segment. Thank you, ladies, for doing this.
Yeah.
Thanks for joining.
Absolutely.
Okay. Well, it is that time. It is 12 o'clock. And I know we do have 13 people registered. We'll just give it maybe like a minute more just to allow those people time to log on. But for those of you that were just able to come on, go ahead and put your contact information in the chat section. That way we can all follow up with each other after this. And Blair, I love that hat. You look so cute today.
Can't hear you.
It gets today.
There you go. What's it say?
Deep girl.
Oh, well, there you go.
I decided to give myself a Christmas and birthday present in December and bought myself a Jeep Wrangler.
Oh, nice.
Oh man, what a gift. What a gift to yourself. That's
Two-door
awesome.
soft top. So when the weather gets better, I'm taking people for rides, so let me know.
Well, hey,
Perfect.
yeah, Carrie's head perked up. Yeah, absolutely. Come pick us up one day.
Mario has a Jeep, but it's like an older one, so I'll ride with you, Blair.
Who'd you say has one?
I said my husband has a 20-something-year-old Jeep, so I'm gonna ride with you.
Yeah, but that was my initial thought, was to get an older one and kind of refix it up. And then I was like, no, I want a newer one. So I found a 2019 with 4,900 miles on it. And I'm like,
Sold.
wow, that's it.
Nice.
Very nice. Congratulations.
Thank you.
Yeah, that's cool. I know a really nice beach you can bring that to.
Cool. Let me know. I'll come on down.
Yeah, heck yeah.
Matagorda has lots of like nice driving areas
Oh, yeah.
for Jeeps.
It's nice.
Is your house almost getting closer and closer?
No. We're about 6 months, 5 months out. So it's
Ah,
getting there.
getting there. Hey,
Yeah.
Margaret, morning or afternoon now. Okay, well, I guess we can go ahead and get started. I'm very happy to have MD Anderson putting on this series. This is the second out of, I think, 6 of them. Is that correct, Laura?
It's either 4 or 6, I think.
I think it was, I don't,
Maybe
but
it's
this is the
6.
second
We'll go
one
with
of
that.
them. So for anyone that is interested, we are having these MD Anderson webinar series on the 3rd Tuesday of each month. So you can catch us back again. Let me see what the date would be, on May 18th. And we'll have another installment of one of these webinars with awesome, very informative topics. And I would like to introduce our guest. We have Kendra Windish. Did I get that right, Kendra?
That's
Yay,
right.
awesome. Kendra is going to be our guest speaker for today, leading us into cancer symptoms women should not ignore. I mean, is it a back pain or an ache? I don't know, but we probably shouldn't be ignoring it, right? And then Laura De La Rosa, who will be assisting Kendra as well. All right, so let's see. Kendra, go ahead and take it away.
All right. Thank you so much for having us. And I think we just looked, the next one in May is about skin cancer, I think.
Oh, that's a very
That's
appropriately
coming
timed,
up. So yeah, that's another good one and good timing. If you're going to take the doors off the Jeep, you're going to need to
Yes.
talk about sunscreen. So a little bit about,
Always.
okay. I'm Kendra Windish with MD Anderson Cancer Center, and I cover the Woodlands location. But right now with the Zoom, we're lucky enough we can cover everywhere. So it works out really well. We're going to talk about cancer symptoms that women should not ignore. And just a little bit about my background. I've been at MD Anderson 8 years. My master's degree is in community health, and I've been doing this sort of thing for about 25 years. So I'm very excited to be here. We've had to kind of shift with everyone else for the past year. So the exciting part about having Zoom, like I said, we can hit everyone in the Houston area, but now we've been able to educate individuals all across the nation. So it's been a little blessing in disguise as far as that's concerned. I'm going to go ahead and share. All right, everyone see my slides? Can you nod for me? Great. Okay, so like I said, cancer symptoms women should not ignore. We'll just go ahead and jump right in. There we go. And we do this on all of our presentations. I know you've heard it, but I'm just gonna say it again. We need to kind of stick with the COVID precautions. I think we're almost there, but we still for now need to keep doing what we've been doing and stay socially distanced when appropriate. Wash your hands and wash them for about 20 seconds and do it as often as you can. Hand sanitizer works for that as well. Wear a mask when you need to be in groups, and then get tested if you feel like you have symptoms or you've been exposed to someone else. It's just a good idea to know whether or not you have it so you can protect others as well. All right, so jumping right in, breast cancer is the most common cancer in women, and that is the case. When we're talking about all women's cancers, and we'll define that a little bit, breast is one of them. And so just a few statistics, that breast cancer is the most commonly diagnosed cancer in women and the second most deadly. in women. So he get about 200, it was like 266,000 women every year are diagnosed with breast cancer, which is a huge number. We've gotten really good at at finding it early and treating it. So that's the good news, but there is a lot of it. And then when you look at all cancers that women get, breast cancer accounts for 1/3 of all of those. So then 2/3 are these other ones that we're also going to talk about. So, okay, just a little, reminder here of our anatomy. So women have 2 ovaries, unless they've had one or both removed. And then you have your uterus, which also it can be also called the womb. And then at the bottom of the uterus is your cervix. And then below that is the vagina. And so you can get cancer in any one of these areas. The symptoms can be a little bit different for each of them. And then some overlap as well. And then they're treated very differently too, different medications, different outcomes. So we'll get into each of those things. All right, so since we're on Zoom, you guys can do this for me. So give me a thumbs up if you think endometrial cancer is also uterine cancer. So I'm going to call it that, just it's a little easier. So uterine cancer is the most frequently diagnosed cancer of the reproductive system. Give me a thumbs up if that is true. All right, very good. It is the most commonly diagnosed of those parts. Like I said, breast is the most frequently diagnosed of women in general, but uterine cancer follows. And then, so pardon me, I'm going to told Devin I was working off of 2 devices today. So just a little statistic of all the cancers, not just female cancers, all the cancers. This is the 4th most common diagnosed. And this one is the 6th. Number 6 on the most deadliest for women. And it's often diagnosed in later stages, which is why it's deadly. If we could catch it early, then the outcome would be a little bit different. But what happens with ovarian cancer are the signs and symptoms are very vague. And so we don't catch it until it's already spread. And with ovarian and uterine, and we all know where that's located. It's in our lower abdomen. So if we don't catch it early, it very easily spreads throughout the abdomen. It can go into open areas. It can go into your stomach, into your colon. So, I mean, that's why it's so dangerous. It moves very quickly and we don't catch it. And then some of those symptoms, which we'll talk about them later too, but I'm going to mention them now, like bloating. And I can see a few of your faces. I mean, how many women have bloating? Well, all of us. And so, that's not a symptom you would immediately think, oh, let me go, see if I have cancer. So things like that are super vague and can be lots of different things. And then we miss them, or women choose not to go to the doctor early enough just because they assume it's something else. And as far as cervical cancer, so if you remember, it was the uterus, the cervix is the opening to that. Those rates have declined. And the reason is because we have a screening test, and that's the Pap test, which I'm sure you've all heard of. And I'm assuming you've all had one or many in your lifetime. And so that's when you go to the gynecologist every year, every 2 years, every 3 years, whatever you've decided with your physician. And they do the Pap. It used to be a Pap smear, and now it's called a Pap test. And that is just a yearly screening. So we can catch it early because we're catching it before you have any symptoms. And then also the HPV vaccine is another reason that these rates have really declined. So as far as cervical cancer, we've made some really good strides. So cancer of the reproductive organs accounts for 15% of cancers that are diagnosed in women. So this is just a really good, kind of a generic slide, but there's the pie, and that's all women's cancers, and about 15% are of those reproductive organs, which really is a small piece of the pie if you look at this slide, and it doesn't seem like a lot, but like I mentioned, we're not catching them in their earliest stages. So that's where that 15% can be more deadly than all of the others. Hence one of the reasons we came up with this presentation. We saw the numbers and we saw that it was dangerous. And so we want to make sure and get those signs and symptoms out there. All right, so as far as the symptoms we're about to go over, I don't give them to people to make anyone panic or to scare them into going to the doctor or not going to the doctor. What we want you to do is just know they exist. And then if they, kind of a general rule, if they persist more than about 2 weeks, then we definitely want you to call and make an appointment and at least get it checked out. Because a lot of these also are symptoms of other things that are not cancer, but you know, they're still worth checking out even if it's not cancer. That means there's some sort of problem. So irregular bleeding, and this slide always cracks me up. I've actually felt like that before, where they're stacked up around you and there's so many. But irregular bleeding is a very common symptom of uterine and cervical cancer. So irregular bleeding is defined as bleeding between periods if you are pre-menopausal. Post-menopausal, if you have any bleeding at all, then that's irregular. If you've already been through not the, what is it, perimenopausal, when you're sort of in between and you don't know what you are, then you're probably going to have some irregular bleeding. But post-menopausal, you should not have any. And then any bleeding during sex is also not normal. So you want to get that checked out, especially, if it happens several times. And then let me make sure I didn't miss anything there. And just, I'll mention this several times, but if you're ready for, or if you're due for your yearly exam at your gynecologist, then we want to make sure that nobody is putting that off because of COVID. And I think everybody's okay with it now, but when COVID first started and they were shutting down doctors' offices and we were a little hesitant to get out, then lots of people were putting off their yearly exams, whether it was a Pap test, a mammogram, a colonoscopy, any of those. And we really saw that we were catching cancers later than we normally were when we looked at statistics from last year versus years previous. But I think from what I'm reading now that everyone is back caught up with their yearly exams. But if you or you know of anyone else that's hesitant, make sure they know that the doctor's offices are doing everything safe and shouldn't be an issue to go in. All right, so unexplained weight loss is the next one. And this one, again, makes me laugh a little bit because how great would that be to just, have a little bit of unexplained weight loss. But what we mean by that is when you're not trying. Again, that would also be a good thing, you would think. But when you're eating normally, exercising normally, and you are dropping weight much faster than 1 or 2 pounds a month, and that's when you're trying. You want to drop 1 or 2 a month. Then you definitely want to ask. That can be a symptom of, again, many things, but cancer and a lot of different cancers, not just cancers of the reproductive organs, anything in the abdomen, stomach, colon, especially. So if you have that, at least ask your doctor, make an appointment or make a phone call to the nurse and explain what's been going on. Constant fatigue, we all are exhausted. And, but what we mean by this is that no matter how much sleep you get, no matter how rested you are, no matter how well you're eating, if you're doing all the right things and you still just cannot get out of bed, then that's really fatigue, where and I call it pregnant tired. If any of you had kids where you just have to lay down and take a nap, then if it persists, if it's one day you get rested and then you're okay the next, that's probably not what it is, but this will persist for several weeks. You want to get that checked out. And appetite changes are important. As far as the female cancers, because of where they're located around the stomach. So if you have any sort of mass, sometimes it will press on your stomach and you won't be able to eat as much and you're always going to feel full. And so that's something you want to be aware of. And then, or if you're just not wanting to eat at all, and if it persists for that, 2-week time period or so. Pain is not normal. So if you have pain that does not go away, if it's severe, especially if it's accompanied by some bleeding, that is something to get checked out. And, you know, if you have a lot of pain, I would hope you don't wait a full 2 weeks on that. You want to get that checked out if you're uncomfortable. Okay, change in your bathroom habits. This kind of goes along with the appetite changes. Everything's all in our abdomen together. So if you have any sort of mass, then it can press on your colon and change your bowel habits. Or if whatever cancer you have in your reproductive organs has spread to your colon, then it can change your bathroom habits there. So anything changes, whether you become very constipated or have very loose stool for a long period of time. So even if you're not rushing to the doctor with any of these are all the ones I want you to keep in mind when you do go to your yearly appointment, that you tell them that these things are happening. Don't ever think it's a stupid thing to mention, especially the ones we're listing today. Just, you know, always the doctor's heard it, whatever it is, and whatever you're telling them, they've heard worse. So don't ever be afraid to tell them, and to ask men to do the same. They're not very good at bringing up these sorts of things. They're a little bit embarrassed. So if you can encourage them to do that, that's important. All right, so breast lump, let me make sure I'm not missing anything here. So as far as a lump in your breast, that is kind of the most common thing we hear. Somebody found a lump and then they go and they, you know, get it checked out, which is a fantastic idea. Many times they're non-cancerous. So they're benign lumps, they're cysts, but you don't know that by just feeling it. So you really have to go in and get some imaging. And sometimes it'll be one that's deep in your breast. Sometimes it's very easy to feel. Sometimes it's a hardening of the skin on the outside if it's close enough. If whatever mass on the inside is close enough to the edge of the skin, it can actually change the way the skin looks. And then also be sure to check your armpits, because there'll be lumps there as well. Your breast tissue goes up into your armpit and also up under your collarbone. So if you feel something there, you want to make sure and get that checked. And then of course, under your armpit is also lymph nodes, and that will be more of a softer, it'll be like a softer lump if it's a lymph node, but any swelling under there is something to get checked out as well. All right, so give me a thumbs up if you think a breast lump is the only warning sign of breast cancer. There you go, see heads, good. I know we ask some silly questions, you never know. Okay, so this is a great slide. It tells you everything. So these are other changes that can happen. You can get redness of the skin, and that's an inflammatory breast cancer. It's very aggressive. It's very rare, luckily. But if you have that and it's not going away, and it doesn't go away with any sort of lotion or I'm trying to think, like the hydrocortisone cream, you know, anything like that, or Benadryl cream that you would use, then it's not a skin issue. It's something that's happening underneath. A lump, we talked about already, swelling. So when you look in the mirror, and we usually have one bigger than the other anyway, but if you have one breast that has changed and it's now not the same size that it was. Lump in the armpit we talked about, and the orange peel texture, same thing. Some cancers are very close to the skin and they actually change the look of it. And then dimpling, if there is a mass and it gets to a certain size, it'll actually pull the skin in, and it'll look like you have a dent in the skin. And so people think, well, that's not a lump, it must be okay. But there's probably one deep in your breast that's pulling the skin. So make sure and look for that. And then our nipples, that they are a telltale sign of a problem. So if you have any discharge that you didn't have before, then you want to bring that to your physician's attention. And also extremely important is they're going to ask you what color it was. So make sure that you know, was it clear? Was it milky colored, or was it a darker color, which means it probably had some blood in it. So that is definitely a question they will ask. Look on the inside of your bra. You'll be able to tell there sometimes what color it was. if you didn't see it come out, but you just saw it on your clothing. So just take that information with you. Sometimes if the mass is right behind the nipple, it'll pull it in. And so it'll just kind of look like it's disappearing a little bit. And then change in direction when you're looking in the mirror. Is it pointing now up, down, right, or left? An ulcer, sometimes it'll make a sore on the nipple. And then scaliness, again, if it's not dry skin, you know, if you put lotion on, it doesn't go away, then you want to let somebody know about that. So we've talked about this already a little bit, but when all these things happen, we want you to call your doctor and let them know. And you can always do that first step, like I mentioned, to call the nurse and have a conversation. This is what's going on. And they'll say, hey, let's make an appointment, or, you know, let's give it a couple weeks. Let me know if it changes, or just call and make an appointment, whatever you're more comfortable with. And so getting a mammogram, as far as recommendations after age 40 is what MD Anderson recommends, unless you have a family history or you found some sort of lump or had any of those symptoms we talked about. But generally speaking, if you don't have any risk factors, you'll start doing this at 40. The 3D mammogram is great. I think most places have that now. It used to be where you kind of had to find a place that had it, or when you got there, you would have the option. I think it's getting to be the standard of care at most places. And the 3D mammogram just gives a better picture to the physician, and they can find things even smaller than what they were finding them before. And then if you have a family history, talk to your doctor about that. You might want to consider genetic testing and then starting your mammograms at an earlier age. And getting your Pap and HPV test. Both of those are now important. I know for years they only did the Pap test. Now they add the HPV test. If you're negative on the HPV test, you'll probably only need it every 5 years or so. So not something you have to do constantly. And then the Pap test, we'll still recommend, it's every 1 to 3 years is how it's worded. It's really going to be up to you and your physician what your family history is versus what your personal history is. Have you ever had any abnormal cells found? They're going to want you to come every year. But then sometimes if there's nothing there, they'll say 3 years is okay. But that's, again, and even sometimes 5 years. I mean, depending on your age and all of the things that we've talked about. Let me make sure I didn't. Yeah, okay. So give me a thumbs up if you think women should get tested for, or if all women should get tested for uterine and ovarian. Remember, the cervical is the Pap test. Now we're talking uterine and ovarian, the other parts. I get confused, but between all the women parts. So the tests there are no screening tests for these. So like I said, you have your Pap test that screens and can possibly catch your cervical cancer at an earlier age. There aren't any for these. So when you go in, they'll feel around and make sure they don't feel any swelling or anything abnormal. If you have any symptoms, you can tell them. But as far as a screening exam, there's not one. So just going into your doctor and having that conversation and doing the Pap test, then that's the screening that you'll get unless you have any symptoms. The HPV vaccine, MD Anderson recommends this. We talk about it with whatever group will let us come in and talk about it. We think it's extremely important. It has dropped cervical cancer rates drastically, and we love it. If we could convince everyone to get it, we could make cervical cancer almost go away. About 90% of the cervical cancers are caused by this particular virus. And then now that they also give it to boys, then the rates are even lower than before. In men, the HPV virus, or it's the human papilloma virus, causes throat cancer. And so those rates are raising alarmingly. So we want to get as many people vaccinated as possible. The FDA has now approved the vaccine for this virus all the way up to age 45. So that's exciting. So people that didn't get it at a younger age can now go in and get that. We've had a crazy number of vaccines come out lately. There's someone in the waiting room. Oh, do you see that, Devin? There's someone in, oh, you got him? Okay. All right. So another thing we can do to help reduce our risk is to maintain a healthy weight. These cancers that we've talked about, most of them, your risk is increased with higher weight because fat cells have more estrogen, and estrogen feeds a lot of these cancers. So just maintaining a healthy weight will automatically reduce your risk. And then also the more fat we have, the more inflammation we have. And cells will start to divide, and they'll do it, well, they divide every day, but they'll start to divide uncontrollably and form a mass with more inflammation. So that's another reason that we're constantly asking people to maintain a healthy weight. It goes for women's cancers, it goes for men as well, for those cancers. So the weight is extremely important. All of this affects hormones. Menopause affects our hormones, as we all know, and then that increases our risk with age as well. So maintaining a healthy weight, especially during menopause, which makes it even harder to do, is extremely important. And staying active helps with maintaining your healthy weight. What MD Anderson recommends as far as activity is 150 minutes of moderate exercise every week. So the reason we say that 150 minutes is because you can split that up however you want to in as little as 10-minute increments. So if your job does not allow you to go do an hour, hour and a half at the gym every day, then don't worry about it. Do 10 or 20 minutes on your lunch break, 10 or 20 minutes right before work or right after work, and just fit your 150 for the week in that way, if that's how you need to do it. Because I think sometimes if we want people to do an hour at a time, it becomes overwhelming because they're so busy, or that's not, they're not comfortable with exercise. So if we can break it down into smaller bits, it makes it easier for people. If you like a more vigorous exercise, if you're a runner or you cycle or you swim, then you can do as little as 75 minutes per week. And, think of other things that you're doing. If you're cleaning house, yard work counts for that. We definitely get our heart rate up for that, especially in the summer around here, walking your dog. So it doesn't have to be time, at the gym holding weights. All right, limiting alcohol. Alcohol, when it's consumed, and it goes through our liver like it's supposed to, and our liver does its job, it will produce chemicals as it's going through that process. And those chemicals that are produced as our bodies are trying to get rid of it, those are what cause cancer. So limiting alcohol is a fantastic idea for lots of reasons, but specifically for lowering your risk for or all cancers, specifically breast. So we know now over the past couple of years, they've really put out a lot of research with ties with alcohol consumption and breast cancer. And I've paid attention to that. I am a breast cancer survivor. So I try to, I shouldn't say try, that makes me sound terrible, but I'm trying to avoid alcohol. I'm not trying to just limit it. I'm trying to avoid it because I know I'm already at risk. So if you have it in your family, please do your research and look at that and make sure that you're doing yourself a favor. It also, if you have too much, it'll hinder your sleep, and then you're going to be less likely to eat what you should be eating, less likely to exercise. It sort of is the domino effect in regards to reducing your risk for cancer. And then I just want to let you know, so as far as recommended amounts, when we're saying limit, women should only have 1 drink per day, and men 2 drinks per day. And I always get the questions, so I like to answer it right up front that we don't get to save them up and do them all on the weekends because that's really just putting a little more stress on our liver at that time. It's actually better to, if you're going to have alcohol, to spread that out and kind of give your body a chance to get rid of it. All right, avoiding tobacco and vaping. Tobacco is extremely dangerous. We can't argue with that anymore. We know that vaping also is addictive and dangerous with our lungs, or to our lungs. We know that tobacco, however it's consumed, and vaping is also difficult. If somebody gets COVID, it's more difficult for them to overcome it because they already have some issues with their lungs, and we know COVID attacks the lungs. So anyone that is in that group that is using tobacco, then they're at higher risk for many things, including cancer. And then it is, we know there's a direct link also with cervical cancer and smoking. So if you know anyone that does that, please consider encouraging them to quit. And we have lots of tobacco cessation programs at MD Anderson that individuals can get involved in. If you need that information, just let us know. All right, so as far as family history, I've mentioned it many times throughout the last 30 minutes or so, but knowing your family history is important. There are many cancers, and we find out new ones every day, that there is some sort of tie to our family history. There's also, if you've been diagnosed already with some sort of cancer, then it puts you at risk sometimes for other sorts of cancers. So it's always good to get checked. When I had my mastectomy 8 years ago, I did the genetic testing, and I just had it redone because over the past 8 years, they found all these new genes, and we're finding new ones every day. So if you have already had it, it's good to have the conversation to make sure you don't need to redo it, to make sure you're not at risk for other things. All right. So at MD Anderson, we have all of the care. I know Laura has probably explained that to everyone. We do screening exams. We do just regular mammograms. You don't have to have a diagnosis to come into the West Houston location and get those done. Skin checks, colonoscopies, those sorts of things. And all the other hospitals do it as well. If you have a place that you go, that you've been going, we just want you to go when the time is there. And as far as these presentations, we do them for free. We do them to any group. So if any of you have a church group or another group that would want us to come out, or by Zoom, I say come out. At some point we'll be allowed back out to do these in person, but we're happy to do that. I think that is the last, yeah. Here's a little bit of information for you. And then Laura can put our email in the chat, but there's a 1-800 number. And then also this website, the mdanderson.org/prevention. It is an excellent resource. I use it all the time. If I want to learn more about artificial sugars or different kinds of waters that people say are healthy, or any of the holistic medicine, I just type it into the search bar on this mdanderson.org/prevention, and I can find articles that are written by our physicians. I can find research, whatever it is that I need. So please use that if you have anything that I didn't get to today. All right, I'm going to stop sharing. All right, I'm going to take a drink real quick, Laura, but if there's a question.
Yes, so Kendra, we had one question. We actually have two questions, but could uterine and an ovarian cancer be detected via a urine or blood test?
I don't believe so, but what they can see is that like, I don't think it would be, they would do a biopsy to make sure that you had it. But what will show up And your blood test is an increased number of white blood cells, which means your body is fighting something. But I don't know that they can pinpoint it to where exactly it is without going in and doing some imaging. They would do an ultrasound or a CT scan or something like that, and then, or they would do a needle biopsy. But it wouldn't be just a blood test.
Okay, and then another question we received is, I understand that having the COVID vaccine can cause lymph nodes to swell, thus causing a false positive test in breast exams. Is this true? And I also linked our article, Kendra, 7 things to know about the COVID vaccine and mammograms.
Perfect. Yeah. So yes, it can. And now that we know that's happening, we are asking everyone that is scheduling their mammogram when they had their vaccine. And then 6 weeks is about what you want to wait. If you can do one or, do it either 6 weeks or get your vaccine and do your mammogram 6 weeks after, that's ideal. But what we don't want, and this came from one of our breast radiologists in the Woodlands, she was asked this question: if you have some sort of lump or any of those symptoms that I talked about, don't wait 6 weeks. They are used to seeing swollen lymph nodes. They know to look for it. They know what not to look for. So if it's just your regular yearly, yes, wait your 6 weeks. If you're going because you're worried about something, go in, just make sure and tell them you got it, and they'll be able to tell the difference.
Okay, and that was the only questions we had in the chat. I don't know if anyone else has any questions.
Did anyone else have any questions? Feel free to just raise your hand and then we can call on you to ask, or you can put, oh, look, looks like Carrie has one.
Yeah.
No, I have not.
It's Lucy.
Oh, was that Lucy?
It's Lucy.
But in your office, I have not heard anything about that or when it will be available. And I don't think MD Anderson has put anything out specific to that.
I have a question.
Okay.
Does having low white blood cell count, just say you have your blood work done and out of nowhere you have a low white blood count cell that's low or high, I'm sorry, that's high. Does that mean your body always is fighting something?
It could be, yeah, but it could be lots and lots of things.
Uh-huh.
I wouldn't, necessarily say you have cancer because of that, but yeah, that's something they look for when they do blood work, but it's definitely not like it's just a sign for them to go and look and try to find out what's going on. Does that make sense?
Yeah, thank you.
I have a question. I had my COVID vaccine 4 weeks ago, and I'm scheduled for a mammogram at MD Anderson in the Woodlands Friday. That's 4 weeks. Do you think that's okay?
That's probably okay. All I would say is just tell them.
Okay. Okay.
Yeah. And I think they're at the point now where they're asking.
I bet.
just to keep that from coming up. They don't want to do any unnecessary tests on you.
Okay. That's super. Thank you.
You're welcome. I'm glad you're coming to the Woodlands. They're my people.
You guys might run into each other there.
Yeah, definitely.
Where I do all my
doctor.
stuff.
It's usually downtown, but she's in the Woodlands now, and I follow my people. So I'm glad to be going out there.
Are you still working remote, Kendra?
I am.
Okay. And what about you, Laura? Are you still working remotely as well?
Yes, I am.
Oh, okay. And you guys liking it still?
Oh, yeah. We worked remotely prior to the pandemic, so we're pretty used to it. We worked remotely, but we were obviously out in the community doing events and other things. So it's been an adjustment as far as.
I do miss seeing you in the community and in our events. I do.
Yeah, so we're not able to do that right now. So we miss it a bunch, but we're hopeful that we'll be back out soon.
Oh,
Fingers crossed.
Yeah.
Carrie just shouted that she misses you.
Oh, I miss you guys. I miss people.
We just miss everyone, right?
Well, this was a really good event and really informative, a lot of different information. So I'm really glad that you guys were able to do this for us. Before we log off, did anyone have any more questions for Kendra or for Laura? Oh, we got more. Yes, Sarah.
I do. Is it available for anybody to have cancer preventative screening at MD Anderson? I know that I do because I carry a cancer gene, but is that available to just anyone?
It is. So that's sort of a misconception that our team, myself and Laura and a few others, they're out in the community, that you don't have to have a diagnosis. Really what you want to check before you come in and get your regular screening is just make sure your insurance.
Yes, of course.
Which I think we're going to do before we schedule you anyway.
Sure.
I want you to walk away with a bill that you didn't know about. So, but yes, anyone can come get their mammogram. We have those available at the outlying locations, but then also we have a cancer prevention center down at the Med Center that can do all of those. And I think, Laura, I think you're a little more well-versed about that center down in the Med Center, but.
Right. Yeah, we have our cancer prevention building, which is in the Texas Medical Center, but our Houston area locations do cancer prevention screening as well. Not all of them, but some of them. So it depends by facility. So reach out to Kendra and I, or call the main line, and they can get you directed on where to schedule.
Oh, okay, awesome.
And one thing I did want to plug is, I know everyone on here is probably familiar, but just a reminder that MD Anderson West Houston is right there in your community off of I-10 and Highway 6. And if you guys need anything at all, please feel free to reach out to me, and I'd love to be a resource for you.
It's absolutely wonderful because you have one chart in my chart and you can see what's going on and all the tests that you have. And it's just a fabulous thing. So I really appreciate MD Anderson for sure.
Thank you, Sarah. We appreciate you.
Thank you.
And I'll throw this out, as far as all mammograms, it's important to have a baseline. So if you've been going to a place for a long time, that's great. If you want to switch to another place, whether it's us or anyone, I'm just talking about mammograms in general, make sure you bring those old ones with you, because we want to see what's been happening, or whoever you go to is going to want to see what happened in the past. So you don't ever want an unnecessary biopsy for a spot that's been there 10 years and has not changed, or something like that. So just keep that in mind if you ever do switch to a new place.
Absolutely. And I think, Blair, did you have a question?
You had mentioned something about like the testing once every 1 year, 2 years, or 3 years. Is there kind of a new protocol as far as like the well woman gynecological, like how often that should be?
Yeah, it depends on your family history, really. I know, I had mine every year. After a certain age, they say every 3 years, and then after, I have it. Actually, you're going to get it by email, Devin, but I just don't have it right in front of me. I apologize. But and then after that, it'll be every 5 years, and that's only if you've not had any issues. We also know that some gynecologists are like, no, I want you to come every year. So, but we don't want you to go more than what the recommended years are. If your insurance pays for it.
Awesome. That's great. She gave a thumbs up. So
And Kendra, you said you're going to send Devin.
Yeah. So Devin, you'll get a couple of brochures.
Okay, great.
By email, and you can send them out to everyone. And one of them will be those age groups for men and women. So, if you're
Okay, great. So
everyone,
when I get those brochures, I'll send them out to you guys as well. So everyone has all that good reading material. Oh, and it looks like Karina, she's behind me. She wanted to come in and just say hi real quick before we end. So guys, don't forget to download the chat section here. It has a lot of good information in it, a lot of good contacts, and it looks like an article that Laura De La Rosa posted in the chat as well. So please be sure to download that, or just copy and paste it into like a Word document or something like that. And again, Kendra, this has been great. So thank you so much for putting this on today. And thank you so much for Laura for coordinating this with us.
Thank you everyone for coming. I would put my video on, but apparently Devin has taken me off my video capabilities. So I'm really here.
Thank you for having us. We really appreciate the opportunity.
Yes, ma'am.
Thank you guys so much. We really
Laura.
appreciate you.
All right.
All
Hope to
right.
see you soon.
Thank you.
Bye guys.
Bye.